have obstacles to cure that involve the mouth. So other problems that these patients will have include wounds from old surgical procedures, infections, lacerations, injuries, fractures. This has been known for decades in Germany. They're called Storfeld in German, which means interference field. And there's a discipline in Germany called neurotherapy, which involves finding and fixing those wounds with either injections of procaine, a local anesthetic, or other agents. So this is important because not all of these factors are relevant to all of you, but I have seen patients who, when you take a very detailed history, will tell you that after that ankle fracture, they were never quite the same. Or after that episode of mono, they were never quite the same. Or after their surgery, or after their pneumonia, or after their root canal procedure. And often they don't make that connection until you take a very detailed history and probe them about it. So we talked toxins, we talked wounds. I want to talk a bit about emotional trauma, because it's something which I think is probably, of all of these 5 factors, the single most important contributor to dysfunction and stress of the nervous system. In some cases, these emotional traumas are very obvious. Someone was sexually abused as a child, someone had an alcoholic parent as a child, someone was living in poverty or neglect. And there's very good evidence that these people have 2 or 3 times the risk of developing autoimmune disease and cancer and cardiovascular disease and all of the other syndromes of neuroimmune dysfunction. But you can also have emotional scars that affect how you perceive stress that come from relatively minor incidents in childhood. There may have been a day when you were in the hospital for 4 hours for some sort of infection and it left a scar. Or a day when you were lost at the mall for an hour and your mom couldn't find you and that left a scar. I think there's still a little bit of a stigma attached to emotional trauma, but I don't think there is a single human being who does not have an emotional scar. And there are lots of ways of addressing those kinds of issues that you can handle on your own. Things like emotional freedom technique, which involves tapping on specific meridian points while you repeat affirmations. Or EMDR, which is an eye movement desensitization response, which is actually being used to treat post-traumatic stress disorder in our soldiers coming back from Afghanistan. Sometimes homeopathic remedies, or hypnotherapy, or a mindfulness-based stress reduction course can help people address those kinds of issues. So I think that's very, very important to address. Infections, number 4, are a little bit of a chicken and egg question. Because on the one hand, sometimes infections can skew your nervous system and your immune system, so they can trigger chemical sensitivities. But on the other hand, when your immune system isn't working right, you're prone to developing increased burden of microbes that wouldn't otherwise be a problem. So many people have addressed the idea that candida can trigger environmental sensitivity, or that chronic Lyme is very common in people with environmental sensitivity, or that it's associated with viruses like the chickenpox virus, or the Epstein-Barr virus, or the cytomegalovirus, or the most recent XRMV virus that has been associated with chronic fatigue. And I think it's difficult to say for sure whether you develop these infections because your immune system isn't working properly, or whether these symptoms or these infections actually set you off. But regardless, it's important to address those infections in some way. So many people have found it beneficial to try a Candida diet for a year. Many people have found that they've had significant responses after having gone to see a chronic Lyme specialist, although that's very controversial still in Canada. And there are physicians who have had their licenses revoked for treating chronic Lyme. And then the last choice, the last stressor is lifestyle choices. And that's something that I would put in a very big category, because it includes diet, exercise, psychological stress, your environment at work, your exposure to electromagnetic fields, all kinds of things about your day-to-day life. I think the single most important thing worth mentioning with regard to nutrition is the importance of addressing food sensitivities. Because there are a couple of sensitivities that are considered real allergies. However, most people who develop MCS or environmental sensitivity eventually start reacting to all kinds of foods. I can't quote studies at this point because they don't exist, but the issue of gluten has been so important in helping these patients that I would encourage any of you who have not already done so to consider a 3-month trial of a gluten-free diet, even if you've had official celiac testing, blood tests or a biopsy that say that you're not celiac positive. And this is currently not a very well understood area, but for whatever reason, many people who test negative still do much, much better on a gluten-free diet. And even when their ingestion of gluten is accidental, they have a very significant reaction. So this, for me, eliminates the possibility that this is just a placebo effect. Dairy is also an issue for many people because of the casein, not because of the lactose. But I think gluten is by far the most important food sensitivity that we have. And we're not exactly sure why gluten is so important, but what we do know is that about 1 in 3 people have the genes that predispose you to gluten sensitivity. And that at some point in your life, some insult on your gut triggers some damage in the intestinal lining that turns on the allergy. And whether it was an infection or an antibiotic or some abdominal surgery or other stressful event, many people recognize that there was a time in their life when they didn't have irritable bowel symptoms and a time when they began. So when you look at these 5 factors and you try to identify which are the most important in an individual's path to becoming environmentally sensitive, and then you combine that with a regimen that includes herbs, vitamins, mind-body therapies, nutritional approach, exercise, the whole range of tools in the environmental medicine and integrative medicine toolkit. You combine treating the stresses with treating the body and then treating the dysfunction. And you get sort of a multi-layered approach to treatment that, in our experience, has yielded the best outcomes. And I know it's very, very difficult in this day and age to access really good integrative care, but the internet is a godsend. It is an amazing resource for people, although there are a lot of minefields out there, to actually applying self-care